work can be considered yours unless you publish it in your name. So that is the key. That's the reason why we should publish. And when we are publishing, this is the format that is commonly used. Like this is the Imrad format. Like first you write the introduction, methods, results, and discussion. And these are the components. Like you first write the title, then you have the authors, the abstract, then you have the keywords, then you write introduction, methods, results, discussion, and then acknowledgements, and then references, and then of course you have some appendices. So before writing any article, you have to understand what should be the format of the manuscript. And for that, you have to go through the author's guidelines of a particular journal. The title is the most important thing. Why? Because that is the show, that is the, people say that, if there's a catchy headline, people like to read the details of what is written under the headline. And that is why title is very, very important, and that should be meaningful, and that should be conveying some message that what exactly is the study. It's actually the advertisement of your article. And when you are preparing a title, you should think about some keywords, and then you can incorporate in that. And ideally, it should not be more than 12 words, and it should be less than 100 characters. And you should not write any abbreviation or any proprietary name or any trade name, etc. in the article. So that is something which is very important. Then as far as authorship is concerned, all the people who have performed the study should be a part of that study. And suppose it's a thesis that is being done, unless there is some definite reason, the candidate who is a part of the thesis and has done meaningful exercise in that, his name should be first, and then of course the co-instructors, the co-guides, and all those names should be there. And all this order has to be discussed amongst all the co-authors. Now coming to the abstract of the article, abstract should best be written after you have completely written the article. Once you have written the article, you exactly know what is the gist of that manuscript, and then you can better write the abstract, which will have its impact. And it depends on the type of manuscript that you are writing. If it's a technique and you are writing a summary, it is in 150 words. If it is a structured format of purpose, methods, results, and conclusion, then mostly, in most of the journals, it is in 250 words. So that gives you, the abstract gives you an idea, a summary of of the manuscript. And it is always written in the past tense, and it refers to the work that you have done. And it should not have references, etc., no figure quoted in that. Then you come to the manuscript per se. When you are writing the introduction, that is the first and foremost thing. So you should write, where are we at this point of time? Like in a particular scenario, we have to give the background information, that where do we stand in the current literature, in the current scenario, in the current scientific standing, in that particular topic, what all we know. And then in the last line of the introduction, you should write that what are we aiming for, and what new thing that we are aiming for in this study. So that is something which should be written in the introduction. And you should always write the research question in that what is your research question, what exactly you are hypothesizing. So all these things should be written in introduction. Now, coming to the materials and methods, you should be absolutely complete. It should be comprehensive. It should include the subjects. It should include whether it's a human study or an animal study, and then what is the methodology. And it should be written in such a way that the reader can read and understand and can reproduce in his own setting. So methodology is the key that will send the information to the readers that this is the way it should be done, and this is the way how you can replicate in your own setting. Uh, and of course, you have to explain all the methodology in great details. And you have to write about the number of individuals, whether this sample size is adequate or not. So why you considered this sample size, what was the reason for the sample size. So all these things have to be written. Now, once you have done the study, then you start thinking about the results. And results should be written thoroughly. There can be headings, subheadings, like demographic data, then related to visual outcome, related to comfort, related. So you can have subheadings in the results, and you should write all the data, and it should again be written in past tense, because obviously you have done the study and this is the data that you have got. So you should write the data, and no interpretation should be written in results. That is very important. And if there is too much of data for a particular point, then you can make a table of that, and that should not be duplicated in the result section. And again, if there is some trend that you are showing, something, some linear correlation or a trend of change of any outcome values, then the trend can best be shown by figures, because that will depict the actual change with time. And as I said, the tables and figures are the ones wherein you put in data which are not there in the results. You can refer in the results, that refer table 1 or table 2 or figure 1, figure 2, but that should not be, the same thing should not be written in the results. And also sometimes what people do, that they have a table of certain data and they make a figure as well of that. There's no need for that. If you have written a table, there's no need for figure of that. Then coming to discussion, which is of course the hardest, most difficult part to write, because you have to understand your own outcome, the outcome of your own study. Then you have to go through the outcome of different relevant studies. And then you have to compare and say that how different you have, what different is your data. It may not be different, it may be same. Then you can also say that, okay, there is no difference. There can be some negative information. There can be something that it is not helpful. So that also should be written, because many times, say some procedure which is not, you have done in 10 eyes and all the eyes, that procedure failed, then that can have people may say that the procedure has not yielded any result. No, it has yielded a result. It has shown that this procedure is not helpful in that particular condition. So this is all interpretation that you have to do after studying your own data and after studying data of other studies. So in the first paragraph, you state the major findings, and then in the middle paragraph, you focus on your result and then discuss, and the last part, you write the conclusion. And the biggest mistake that people do is that the extrapolation of result in a different way in conclusion. Like suppose 10 patients had undergone some procedure, say a glaucoma procedure. There was a reduction in some amount of IOP. So you can say that this procedure in this set of this cohort of patients can do this. You cannot extrapolate to all the cohort, to all the population, to all age group. So you have to be very specific in your conclusion, and there shouldn't be any unnecessary extrapolation. Then as far as acknowledgement is concerned, you have to acknowledge people like your technicians, people who have helped you in doing the study. So acknowledgement is something which is again very useful. And referencing is the standard way of referencing is the Vancouver method, but then there are other methods as well, like Harvard format, then alphabet number system, and citation order system. So all these are different methods, but most often it is a Vancouver system that is followed, and the citation method, like the number one reference, will come first in the manuscript. So this is how in most of the journals they do, but in some journals they do it as alphabet as well. And a very important point is that one should not put their own personal gut feeling in the manuscript, that and don't write any quote related to that. We have to be absolutely scientific. There's no place of literature in that. That is the most important thing. And all the authors have to read and proofread the manuscript in order to have the approval of all the authors. So this was briefly about how we should write a manuscript. Now the question is that how we can inculcate this research acumen in residents. Any institution cannot succeed in having a good academic strength unless all the three tier of the institution takes part in the research activity, like the consultants, the registrar level, and the postgraduate level. So these are the three-tier system that works in most of the institutions. So everybody has to participate in research, and that is why we have to inculcate research activity. And these are the key elements of any residency program, and the concept of research activity has to be inculcated. Now, there's point that why it should be inculcated, why it is important, because these days it is a competitive world and things are changing. We have to learn this thing. Now, even at small places, even in small institutions, there are many people who are doing studies, who are reporting. And if you don't do that, then you will lag behind amongst your peers. So that is a very important thing. You have to compete and you have to be at par with your peers in order to do that. And you have to be a better doctor, because the resident, if he thinks about the methodology, or maybe the teacher suggests that this should be the methodology, and he reads it, he goes through it, then he will understand that, okay, for this particular study, this is the methodology that should be followed. And if he reads the conclusion, he will understand that, okay, this was the finding, and the conclusion is this, so it should be written like that. So his thinking changes, his thinking becomes more scientific, and that is what we have to do. The thinking of every resident has to change. They have to think about, how research can be done. Research doesn't mean working at the molecular level. Research is something that you have to keep your minds open, that what is known in literature and what new thing you are observing in this particular condition, in this particular case. And if you report that, then that will help other people to become more, better clinician. Like, for example, there's so many articles on post-classic keratitis and what are the microorganisms that are involved in that. Oh, why do we have to know all that? The reason is this, that if we get a case of post-classic keratitis, then at that point of time, you will investigate for those organisms. That is the key. So that makes you a better doctor as well, a better clinician as well. But then this survey, this was done, and this was a survey done for looking for the reasons why residents are not involved in research activity at various places. And they found out that the lack of time was cited as an obstacle for research by 74% of residents, of which 66% felt that training in their specialty consumed most of the time, and 42% admitted lack of research curriculum as an obstacle. So that is something that, even at the level of various institutions, at the level of MCI, at the level of DNB, things have to be done in such a way. And even in the interviews for senior residency, it is always asked that, have you published any paper or not? Have you done any research or not? So this is that we have to inculcate in them, that time management is the key. The person who manages his or her time in the best possible way succeeds in life, because everybody gets these 24 hours only. So you have to manage your time in such a way, and that is something we have to encourage them, that whenever you get even half an hour time, instead of just gossiping in the ward, or instead of just hanging around somewhere, do something related to research. How you can do it? You can make a curriculum, you can sensitize them, you can tell them the importance, you can cite examples of the peers who have done well, the seniors who are so well known in the field, in this field. Why they are known? Because they have done this research activity. And once again, I will tell that research doesn't always mean that you have to work at the molecular level. Research also means there's a clinical research, so that element is also there. So how will you start? You have to think broad first. The first thing that I would ask my resident is, whenever a resident comes to me and asks me for the thesis topic, I will tell the resident that, okay, this will be a broad topic, and you just have to think like suppose phakic implants, I will say that, okay, you have to think about the factors related to vaulting and go and do literature search. So the first thing that a resident should do is literature search, because that will give them the idea that what all has been done in this world, what all has been done in this particular field, in this area. So literature search should be done, and then of course ask, we have to discuss with them that what do you think, what has been done, and what more needs to be done, what are the problems. So that is something we have to tell them. And the second important thing is that once they have done the study, then they have done the study under the guidance of some seniors. So we have to tell them that what exactly has been done. You have to put it in Excel sheet, and now you have to think about how to write the manuscript, how to analyze it. Little bit of biostatistics, little bit of information about how we can write the manuscript. And of course, we all have to create in various institutions the workplace environment wherein, the residents should have access to all these facilities related to computer and internet so that they can keep working. And we have to provide them educational supplies in terms of journals, in terms of online journals or physical journals. So these are things. And another thing is that we should always, in order to inculcate research activity, we should always have a journal club in all our institutions. That is very important, because you can review some article and then you can tell us that what is plus point of this article, and try to figure out what is the lacunae in that article, and that will inculcate that thinking skill amongst the residents. That's the most important thing. And of course, funding and etc. has to be done by the senior member of the organization. So thank you very much for your patient listening, and would definitely like to have inputs from you all.
Thank you, sir. First, I would like to thank you for accepting my invitation to present your keynote address. Thank you, sir.
Okay.
And thanks you also for sparing your valuable time for this keynote address.